Yeah. Today. It's a boy Rust the morning. Really take a mo lulu akọlu mi diri lọsọ jara ti lọra bàtà ní bàtà yẹn fún kọ mi. As you all know, I'm Abraham Imole Oluwa pẹ̀lú. Back on the show, sex education. That was cool. Before I go further, I will say both my Instagram and Facebook accounts is gone. I don't know what I do. So for now, my videos will be all available on YouTube only. And before the end of this video, I will post my TikTok link. I want to stay out of Instagram and Facebook. I don't want to open the account for now. So I'll be posting on TikTok and my YouTube in English. So that's it for the special announcement. So bear with me for now till we are able to get a new account. We are still on what are the causes of sexual dysfunction? What are the causes of sexual dysfunctions? And we have treated two. So if you haven't watched my last video, please make sure you go back and watch and learn. It really helps. We've worked on the erectile dysfunction and quick ejaculation. So in this video, we are going to talk about diabetes, how diabetes affects sex. So before we go, what is diabetes? Okay. Ní a ṣì wà lórí kí làwọn tó máa ń fà á tí ọkùnrin ò fi lè dógò dáadáa, tó máa ń ba nǹkan ọmọkùnrin jẹ́ láti lè dógò dáadáa. So a dẹ̀ ti ṣe erectile dysfunction èyí tá à ń pè ní kí ọmọkùnrin má lè jẹ́ kí okó ẹ̀mí dúró for some certain moments, and quick ejaculation kí ọmọkùnrin kó tètè máa dà. So eléyìí ta fẹ́ wò lórí fídíò tí ò ní òun diabetes, ìtọ̀ ṣúgà. So what is diabetes? Diabetes is a disease that occurs when your blood glucose, also called blood sugar, is too high. I repeat, diabetes is a disease that occurs when your blood glucose, what is blood glucose? Sugar tó wà ní ara, ohun tó ń ṣiṣẹ́ fún main energy ara, is too high, tó ti pọ̀ jù. Glucose is your body main source of energy. As I said, your body can make glucose, but glucose also comes from the food you eat. Ara wa ó lè produce sugar, tí ọ̀lọ́ ṣe máa ń pè wá ní ẹran abiyọ̀ lára. So it can produce sugar, and yet we can still consume sugar from food we eat. A lot of sugars from food we eat. But glucose also comes from the food you eat. Insulin is a hormone made by the pancreas that helps glucose get into your cell to be used for energy. Insulin òun ló máa ń gbé glucose lọ sínú cell ara wa, tó pè ní cell, that's a part of our body that tell you it takes everything around our body system. It is used for energy. So when this insulin is not working, àbí tí ò ṣiṣẹ́ dáadáa, then there will be high glucose nínú body system. Then we will have a high blood pressure or high blood glucose, whatever, in your body system that will cause diabetes. So if you have diabetes, your body doesn't make enough or any insulin, or doesn't use insulin properly. Glucose then stays in your blood and doesn't reach your cells. Diabetes raises the risk of damage to the eyes, kidneys, nerves, and heart, Diabetes is also linked to some type of cancer. Take steps to prevent or manage diabetes may lower risk developing diabetes and problems. I won't talk much, kì í ṣe doctor, wọ́n má bàa gbé mi, but that's not where we are really going. How does it affect sex? That's where we are going. So but mo kàn fẹ́ jẹ́ ká mọ tán pè ní diabetes òní. So what is glucose? Glucose gangan, let us talk briefly on it. Blood glucose or blood sugar is the main sugar found in your blood. It is your blood's primary source of energy. I will repeat, blood glucose or blood sugar is the main sugar found in your blood. It is your body's primary source of energy. It comes from food you eat. Your body breaks down most of that food into glucose that releases into your bloodstream. I hope we understand. Glucose yìí òun ló ń ṣiṣẹ́ energy in the body system, which is the sugar. Our body can produce it and we can consume it from food. So it breaks down most of the food and turn it to glucose and works for our body. I hope we have a better insight of diabetes. So how does diabetes as a whole affect our sexual life as a man? First, erection problem, also called erectile dysfunction. Well, if you are not following me, you might not understand what is erection or erectile dysfunction. I won't talk much on it here. ED are common in men with diabetes. So men with diabetes we usually have erectile dysfunction. So especially those with type 2 diabetes. High blood sugar over a long period of time can damage the nerves and blood vessel. The damage causes problem with getting or keeping an erection firm enough for sex. What am I saying here is that this diabetes, high blood sugar, it will damage our blood vessels so that we won't be able to keep erection. Erection ni wípé okó ò ní lè dúró for some certain moment when your blood vessel is being damaged. A disease in sperm motility. A sperm count due to lower testosterone levels of high blood sugar level caused by diabetes can make it harder for men to conceive. I will repeat, a decrease in sperm motility and sperm counts due to lower testosterone level and high blood sugar levels caused by diabetes can make it harder for men to conceive. It will make it very, very hard. If there is a decrease in sperm motility or sperm count, your body is not producing enough sperm. There is a decrease. Then when there is a decrease, that means sometimes you might not even come at all, or very little, and it will be tiny, like ó máa rọ̀ bẹ̀tẹ̀bẹ̀tẹ̀, ó máa ṣàn. So those, when you have high rate of sugar in your body system, your cum or sperm will be very, very light, or it won't even, it kò ní produce, body system ò ní produce ẹ̀ lóní rẹpẹtẹ, and when you are not, you can't conceive láíláí. Or we all know the meaning of conceive. You ní lè, ò ní lè fún obìnrin ní bẹ̀lẹ́bẹ̀lẹ́. Men with diabetes have higher chance of DNA damage in sperm due to several factors. Oxidative stress caused by high blood sugar level can damage sperm cells. Additionally, poor circulation, a common symptom of diabetes, affect the overall health of the testicles, which is where sperm is produced. This testicle, where the sperm is produced, when you have a high sugar, glucose, whatever in your body system, production yẹn kò lè wá bó ṣe yẹ kó wá, kò ní lè produce ọ̀pọ̀ sperm. And when there is poor testicular health increase, the DNA damage in sperm. There is a risk of DNA damage in sperm. That means you won't be able to conceive. Let me go on. Let me tell you some physical symptoms of DNA damage so that we have understanding of what I'm saying. We have some physical, we have some what is, I think we have oh, I've forgotten. I will see to that in my next video. But we have physical symptoms of DNA damage. It is skin abnormalities. Skin abnormalities include premature aging. Almost 40 years, that man will be 80 years. Then you die. Premature aging. The 20-year-old guy will be looking like a 40-year-old guy. That's DNA damage. So see what diabetes can cause in terms of our health. See how bad it is. Premature aging, sun sensitivities, sun sensitivity. Èèyàn gan ò ní lè wo oòrùn. To stay under the sun for 5 minutes gan, it be very hard for that kind of person. An increase in risk of skin cancer due to UV induced damage. Very risky. Skin cancer. You all know skin cancer, but I'm not a medical practitioner, so I won't talk much on that. Neurological symptoms like cognitive decline, memory loss, and increased susceptibility to neurodegenerative disease. Susceptibility means when you feel something want to hurt you, or you always feel suspicious of something, fear sometimes, and it will lead to neurodegenerative diseases. So recurrent infection and impaired immune function due to DNA damage in immune system. What I will say is, if you are experiencing any of these psychological symptoms, it's important for you to consult an healthcare professional. Abeg, if you still you are allergic to sun, you are feeling memory loss, susceptibility, sometimes you any small thing, o ti bẹ̀rù pé nǹkan máa ṣe ẹ́, or you are aging more than your age, please, you need to see a doctor.